Hi guys, welcome back to Normalize The Conversation. My name is Francesca Reicherter and I'm the founder of Inspiring My Generation. And today I'm here with Dr. Mary Nochimson, chiropractor, acupuncturist, licensed massage therapist, and craniosacral therapist. And she's going to talk to us a little bit today about how we can use all of these tools to help with mental health. So thank you so much for joining me.
Thank you so much for inviting me. I'm very excited to be here.
So can you tell me some of the ways that chiropractic care and acupuncture and massage therapy and craniosacral can all really help with dealing with symptoms of mental health?
Yes. So chiropractic focuses around the nervous system. And so in chiropractic, there's a phenomenon known as a subluxation, which is when a bone shifts out of place and puts pressure on the nerve. And when this nerve has pressure on it, it causes the body not to function optimally. It also so what it's actually doing when you get an adjustment, which is when we put the bone back in place, we're relieving pressure on the nerve, but we're also creating more space for the nerve. And more space in these holes that these nerves pass through gives that nerve a better ability to function and breathe. So when I talk about the craniosacral part, we work a lot on the bones of the head. And so if your head is restricted or really like the sutures aren't moving and there's no expansion, then the skull is going to be putting pressure on the brain and the nervous system. So that could be leading to your headaches and other dysfunctions because the brain coordinates everything throughout the body. So whenever you're if you think about yourself kind of like in a plane and you're kind of like really, really smushed together and like you're probably really miserable when you're in that space. But then when you get out, you stretch and take a deep breath. And that's pretty much what chiropractic is. It's getting out of a 2-hour or 15-hour airplane flight and then taking that first like stretch and you can take that nice deep breath. So those are some ways. And then like chiropractic helps a lot with pain, and pain prevents people from doing the things they love. So even if when people are struggling with anxiety and depression, they're able to find certain outlets, whether it's a sport or going to the gym. But if they have pain, then they might not be able to go to the gym and not be able to play those sports or go outside. So chiropractic helps these people decrease their pain so they can go out and do the things that they enjoy and things that they love to do. So I think in just that one aspect, chiropractic does a lot for people who are struggling with mental health conditions. And just to go back to the subluxation part, there's actually three things that actually cause a subluxation. And one of them is thoughts. So that's where mental health counselors and chiropractors can really do a lot together, because if you don't get the negative thoughts out of the person's mind, then it's going to create this subluxation. Yes, it's great for me because I get business, but I'm not about that. I'm about getting the patient better. So a very holistic approach. Then another concept is trauma. So physical trauma, emotional trauma. If you have a person who is really, really great at baseball and they threw out their arm, it's not just an injured arm. This injured arm impacted and changed this person's entire life. So that injury literally crippled them. So then you wind up going and you're talking about like what that injury took away from them, as almost as if like they were gypped, like I got this bad arm and now I can't do what I love. And then the last part is toxins. So the environmental toxins and diet. So in order to have a complete holistic approach to health and well-being, you have to have mental health counseling. You have to have chiropractic and massage and acupuncture. And these are just a couple things just so you can have a balanced lifestyle. So
I love the way you talk about that, because a lot of people think that there's only one way to take care of yourself, right? And a lot of people think mental health, okay, that's only therapy. And then there's a lot of stigma with therapy, so a lot of people don't seek help. But knowing that there's so many other tools that really work together is something that can be so helpful. So when it comes to chiropractic care, what are some of the reasons people reach out to go to a chiropractor?
They could have been in a motor vehicle accident. It could have been a sports injury. It could be if they get injured at work, but also people go to chiropractors just to feel better. Chiropractic is gaining momentum, and people are realizing and acknowledging that chiropractic is important for performance. So performance in your sport, performance at work, performance in school, because it helps with concentration and focus, and also with fatigue. So all these chiropractic is being more recognized, but it still has that little stigma of like, oh, you just go to them for that. But so we're kind of like, and chiropractors have kind of we pigeonholed ourselves, because we are really good at pain, but where we really try is function. So I think that is really important, is to, and that's why people come to chiropractors, is so that they can feel better.
I think that's such a huge misunderstanding that people have with chiropractic care. I know when I was in high school, I was a competitive cheerleader, and I would throw out my back constantly. I was always falling on my face. And I went to a chiropractor, an acupuncturist, and a massage therapist almost every single day for a solid 2 to 3 years, because I was in so much pain. If I didn't have that, I would not have been able to cheer. I wouldn't be able to walk without it. It was something that was so helpful for me, and it would alleviate a lot of mental disclarity that I would have, because I was in so much pain. I couldn't focus, couldn't function, couldn't do well in school. I needed that little bit of help and support. That was such a major benefit for me. And I think a lot of people don't realize that is something that can be so helpful.
It's so true. And I'm so happy you touched on it, is that, your passion was cheerleading. And if you weren't able to cheerlead, I mean, what would that have, what kind of effect would that have had on your life? You wouldn't have been able to cheer, so maybe you have to stay home, or, stuff like that, and not do something that you really truly enjoyed.
So when it comes to acupuncture and chiropractic care, what are some of the symptoms of mental health that it can help to alleviate?
So anxiety, for sure. A lot of people come in, and it's almost like when you get adjusted, I'm sure you could also vouch for that. Like when you get out, you just almost feel like you feel like a brand new person, almost like the last week didn't even happen. And everybody feels that way too. So you of course you would want to go back. I don't really know what prevents people from coming back. Maybe it's just that I feel better, so I don't need to go back. Yeah. So chiropractic, I kind of forgot the question because I was having so much fun answering that part of the question. But
so what symptoms of mental health does it help to alleviate?
Okay. So actually in craniosacral, there's a correlation between depression and 3 parts of the brain all the way down to the sacrum. So if you have a compression, which is a restriction or a subluxation at the lumbosacral joint, which we call the sacral base, that is a correlation, obviously not a direct cause and effect of depression. Then you have the cranial base, which is where your skull meets your neck. And then you have the sphenobasilar joint, which is here on the base of your skull. So a lot of the times by doing craniosacral, releasing fascia and releasing those restrictions, it could help with depression and anxiety. And then also when we talk about release, with craniosacral a lot, releasing the sutures of the skull, creating more space for the brain. If the brain has more space, the brain could function more. That includes the release of your dopamine and serotonin, which is our chemicals for, happiness and feeling less pain. So those are some, symptoms depression, anxiety, and also any mental health condition like OCD. And again, it all comes down to function. So if we could get the body to function better, then the body and the mind can adapt better to everyday stresses.
So what are some of the ways these bones can get out of place?
One of them is anxiety. So when I talk subluxation, that is joints out of place. So we talked about mental health, we talked about physical and emotional trauma, and we talked about toxins. So those are the 3 main ways. And a trauma, again, doesn't have to be a huge motor vehicle accident or a trip and a fall. It could be your overuse injuries. So people are on the computer all day and they keep clicking the mouse. That could lead to carpal tunnel and some hand conditions. You could have your lateral epicondylitis, which is your tennis elbow or your golfer's elbow. Again, just overuse injuries, sprain, strain. If you're sitting especially right now where everybody's doing everything virtually, everyone's sitting like this. So what's happening is you're creating neck weakness, but you're also creating, because the bottom cervicals are so weak, the upper ones have to spasm more to hold this big head on top of your neck. So that could lead to trigger point type headaches and stuff like that. So just every day, it really depends on your job and your way of life, how many visits you may need. Like you were a cheerleader and it was a very physically taxing sport. So you felt the need, like, I need to go in every single day in order to feel functional. Someone else who's just maybe just a student, but also like moves around a little bit, like they may only need to come in once a week. So I don't have like packages in my office. I kind of am like, let's learn who you are and we'll go from there, because I don't sugarcoat. I don't be like, oh, you need this many sessions. I go, let's do 3, or, let's get you better. And then we'll go from there.
That's amazing. And it's crazy how everyday life can kind of just throw your body a little bit out. So having these amazing tools available is something that's so helpful for us to continue on and to function at our best.
Absolutely,
so,
yes.
With acupuncture, I know that there's like specific like stress points that you guys do to help alleviate a lot of stress and anxiety. Do you find that really does help with anxiety? I know it helped me a lot when I was younger, those stress points, that it would stay in until it like alleviated the stress. And then
I think acupuncture is great. So acupuncture is harder to explain than other things because you can't dissect it. You could go into anatomy and physiology lab and you could dissect the nervous system. You could dissect the bones, but you can't just dissect an energy pathway. So for me, it's like just energy flow through the body. When there's an imbalance in the energy flow, that's when your body is prone to anxiety, stress, and like diseases and conditions. So it kind of is almost like becomes your weakest link where bacteria can come in, or like if you are prone to hypothyroidism or any other sort of genetic condition, that might begin to present itself. But yeah, there are points, and everyone's different. Again, like I know that there's like points that everybody presses, but everybody's a person in themselves. If the anxiety is coming from balancing those points, then yay, you're cured, let's just say. But if we don't find the source of the anxiety through the mental health counseling or through craniosacral, then the person's always going to have anxiety. And it's going to be like, so it winds up being, you do have to get acupuncture every so often because you didn't find the cause. Once you find the cause, you could find a resolution and then your body can heal. But acupuncture is something that can help along the way, if that makes sense.
Yeah, that does make sense. And acupuncture can help in so many different ways. A lot of people don't realize, from headaches and migraines to physical pain in your body if you have an injury, helping to heal with inflammation, to mental health. It has such a wide usage. It's not just one small thing. I think a lot of people kind of put it into a box.
Right. And I think that's where people go wrong, even healthcare professionals. Like, it's like you could only go the Eastern way or you could only go the Western way. And that's not true. We should all just be working together, integrating together so that we can like optimize the patient's, health and wellness.
Exactly. So then with massage therapy, I know that like if I get really stressed, I have high anxiety, my body gets really tense. So I found that massage therapy was something that's super helpful for me. Do you find that massage therapy is something that's really helpful for people with mental health disorders?
Yes, one, it's good because it does stimulate the parasympathetic nervous system, which is your rest and digest. So just in that one regard, that massage is based on stimulating this relaxation system will help with anxiety. Another thing that massage does is it moves fluid around. Like it's called like a lymphatic drainage massage. And if you have toxins built up by environmental or dietary, then this is something that's going to help flush those toxins out of the system, along with your nutritional things like water, that are again going to just help get those things out. And when a lot of people do these detoxes, these cleanses, because after all the toxins are out, they have like this burst of energy. So nutrition, massage, chiropractic, acupuncture, all those things are going to help release not only toxins, but negative energies. And, again, it all comes down to just better function.
That's amazing how all these things can really help our bodies. So if I wanted to come in and make an appointment, what would be the best way for me to prepare to get the best results?
I would say definitely do your research, because you have chiropractors who just do auto accident. I would recommend a chiropractor that has a well-balanced practice. They see adults, they see kids, maybe they see families, because then they're not just like kind of like your pill mill. Like if you're going in and you're getting the same exact treatment as the patient next to you, then you're just cattle for the most part. I mean, I never really do the same treatment twice. If I do the same treatment, I'm doing different things within that treatment. It's never really the same thing over and over and over again, especially when it's not, if it's not working, I'm not going to keep doing the same things over and over again. That would be the first thing, is just to do your research, not just check on Google, but also like ask around, ask your friends who's good. Because I think friends give the best, best referrals. And then the other thing is to have a goal. Like, what is your goal? Is your goal to decrease pain? Is your goal to just feel better? Is your goal to lose weight? If so, how can we, what do we want to do to get there? And there are, do I want to have, there's other things I do too, like NAT, which is really great for insensitivity elimination. And if you go to naet.com, they actually have like this particular modality has helped people who've suffered with anxiety and depression. So I just like to learn everything and do everything, but like make sure, that would be the main thing, was what are your goals, and do your research, because one bad chiropractor, unfortunately, puts a sour taste in most people's mouths. Like they don't, like I work in an urgent care with my parents who are medical doctors, and my mom and dad was like, oh, you should see our daughter, the chiropractor. And they're like, oh, I already did that. And then my mom's like, well, you haven't had her yet, because when people come to me, I do different things that people are like, you're right, I haven't got that before. So I think it's the integration of everything that makes my treatment so successful. But you could go to many different people, but you could get lucky, and chiropractic will be the only thing you need. Again, it all comes down to finding the source or the cause.
So when it comes to figuring out if chiropractor or acupuncture or massage therapy or all three, how do you know where to start? What are some tips and advice you can give to people?
I mean, you can start off with whatever one you want, whatever the person feels more comfortable with. I mean, I had the massage license first. A lot of people are kind of like eerie with the chiropractic sometimes, especially like if you have a baby or a young kid, you're like, you're not going to crack my kid's neck. And it's really not like that. It's the amount of pressure you use compared to like pinching into a tomato to test if it's ripe. That is the amount of pressure that we use on children. So they're a good place. Like people who are kind of weary of chiropractic, they might be like, well, let me try the massage or the craniosacral first. If you're like so into like, oh, I want to, I have nothing against the needles, I'm saying that it's like, it's really going to come down to what the person's kind of like feeling. So it's not really about like, where am I going to start? It's going to be like what the person's more or less comfortable with, which is, I mean, it wasn't my idea to do the massage first, but when people come to me, it's just like, do you want, like, where do you want to start? Like, oh, I don't really want to get adjusted. I'll be like, okay, well, here are some other things that I can do. And then when I like learn their body and they gain their trust, then it's like, okay, I think this is the thing that's going to make you better. So again, everyone's different. It really, like, there is no right or wrong place to start. And another thing is like not to try just one practitioner. Like the thing I love about craniosacral is that, I mean, I'm sure other professions are like send out to other people, but craniosacral therapists really send out to other people if they can't help. A lot of people are like, oh, physical therapy didn't work, so you know what? You got to go get surgery. No one can help you. Like, no, like if I don't work as your chiropractor, you try another chiropractor. They have a different energy, a different way of practicing. You have your upper cervical people, you have your Gonstead people, you have like different techniques of adjusting, and one of those might wind up working for you. So that would be my best advice, is to not give up on the first try. Like just because you tried one chiropractor, it didn't work, doesn't mean that another chiropractor won't work.
I love that because a lot of people do. They try someone and it doesn't work, and then they're kind of turned off from it, whether that's with just a general doctor, whether it's with a dentist, whether it's with a therapist, whether it's with a chiropractor. You have that one bad experience. You're like, you know what? I don't even need to go. And then they don't go again. So being able to recognize that even if I don't work for you, I promise that this treatment can help and we'll find someone who will work for you. And that's something that's so important, is to continue trying to make sure you get the help that you need.
Patients appreciate it too. Like if I refer to a mental health counselor, like, thank you so much. Like it really made a difference. I mean, when you don't refer to a person, you're kind of like a person that may be more qualified. You're really letting that patient down. And you're not doing justice by the patient.
I love that. And I love that attitude because it's so, so important. So when somebody comes in, how long or how many appointments do you think it takes before they really start to see relief?
I want to say my magic number is 3, but again, it depends on the chronicity of it. It depends on, is it an acute injury? Is it a chronic injury? But the other thing is, again, like it's all about finding the cause. But because I do so many things, I do the chiropractic. So when people come in the 3 times, they're getting adjusted, they're getting massage, they're getting craniosacral, they're getting acupuncture. So like by the 3rd visit, if there's no change, then to me, I'm like, there's something else going on. But if you're just kind of a one-stop chiropractic or acupuncture, then it may take a couple extra treatments. I mean, it's really kind of hard to say. It's not an easy answer. I mean, I have people who get better in one visit, and then I have people who don't get better really at all, and they have to wind up getting the surgery because we did that many treatments, and they're after a while, it's like now it's not just pain, it's depression. And then that's going to add and feed. It winds up being a positive feedback loop where they're depressed, they're in pain, the pain's getting worse, getting more depressed, So, I mean, it's really important to, not wait too long either.
That's really good advice.
So, but my magic number is 3. If there's no change in 3 visits, I'm like, okay, it's time to maybe see what else is going on.
So when someone comes in, I know you said that frequency is different for everyone. So what are some ways that you determine frequency? Because I know a lot of people go into doctors, and when a doctor says, oh, I need you to take this medicine, or I need you to do this many appointments, a lot of people are like, oh, this is for money. A lot of people have like this skepticism, and then it kind of turns them off. So what are some ways? I think a lot of people don't know the ways that chiropractors determine how frequently you should go.
Unfortunately, a lot of it is insurance. But I mean, so actually, if you can find a chiropractor that does cash, then they're a little bit more, I guess it's not really so fair to say, but like when I was going to school and I was learning about chiropractic, and it's like the business of it's just the business of it. And a lot of chiropractors hate the business of it because we really got into this profession to heal people. And, but like it was like 12 because insurance covers 12 visits. I'm like, well, that doesn't make any sense to me. I'm really a person by person basis. I mean, there's, in acupuncture, there's actually, they say seasonally, because every season your body can change with the seasons. Once a month is your massage lux, your massage envy. I think once a month is a great treatment plan in general if you're shooting for that like overall health and wellness to continue. And also, if a chiropractor is good, they're not going to just adjust you so let's say you're like, okay, I'm going to come in once a month. I'm going to get my spine checked. If you don't have any joints, I mean, I don't know how often it happens, but if go to a chiropractor and they feel all your joints and there's nothing locked up, there's really, you don't adjust a joint that's moving, you adjust a joint that's not moving. So there is a chance that when you go in, you're fine. Like if you go to a dentist and you have no cavities, I mean, that you don't really need to get a filling. So finding an honest chiropractor is just really, really important. But it really, like, to me, like, I just go by the person. I look at the person. I try to figure out what they want out of everything. My first goal is to get them out of pain. And then once a month or every other week is a really good plan. Or it's just to call me when you need me kind of a thing. So, I mean, I just go with whatever the person's feeling, because you don't want to turn them off. A lot of people with the chiropractors like, once I go, I have to go forever. You don't have to do anything. You don't want to. Nothing's forever. If you're feeling great, I tell you, if you go to a beach, like you're on an island and you have fruits and vegetables, and you don't like fall out of a tree or have a little boogie accident, then you probably never have to see a chiropractor, because there's no stress and you're having good nutrition. But in this world where there is so much anxiety and working and people are overworked, I mean, once a month is, I think, a really good, solid treatment plan. But I don't push it on people.
That's really great to customize it to each person and to really help them get the help that they need and the right type of treatment, because it is different for everyone. Some people are doing it just as a regular health and wellness checkup, and some people are doing it because they're injured and they need it to help function better. So it really depends on every person. Thank you so much for joining me today. You've provided so much helpful, insightful information on how chiropractic care, acupuncture, craniosacral therapy, and massage therapy can really help with mental health.
You're so welcome. It was a pleasure, really. The pleasure's all mine. And if anybody ever has any questions, you can reach out to you. You can reach out to me, however you want. I just want to help people reach the right resources. It's not about me. And that's what I learned. But from craniosacral, I learned it's not about me. It's not about my assumptions of what the patient's going through. When I see a patient, I take my whole self out of the equation and I just let the patient be. And I never assume. Once you start assuming, the patient kind of like just turns off.
Thank you so much.
No problem. Be safe and have a wonderful holiday.
You too.